Cancer is a top killer in the United States, and Black women face the highest death rate and shortest survival of any racial or ethnic group.
They are a long overlooked at-risk population, and that's why in 2024, the American Cancer Society announced an ambitious study. Researchers hope to enroll 100,000 Black women and then follow them for the next 30 years.
And as they told reporter Heather Graff, it could be critical in the search for answers.
What's up, family? It's your Radio Love Asia, and I'm giving you all the songs you love for your weekend soundtrack.
Asia Chandler talks for a living.
I'm a radio personality
and stays connected to her community,
giving away 3,000 backpacks.
But she wishes more people would talk about this.
My cousin has breast cancer. My mom had a battle with stomach cancer. My aunt passed away in like 99 to cancer. Two of my very best friends both have double mastectomies, both breast removed. It's an ugly disease.
A disease that is disproportionately affecting Black women, not just in Asia's life, but across the country. Statistics show they have an 8% lower cancer incidence than white women, but a 12% higher cancer mortality. And Black women under age 50 are twice as likely to die of breast cancer than white women.
Do you worry about getting cancer?
Of course, we all do. It seems like when the studies are done, they're not people like me. They're not done on women like myself. And so when trying to create a treatment plan, you don't have the knowledge.
It's true, according to researchers with the American Cancer Society.
And due to those low numbers, a lot of what we know and understand about cancer may not be relevant specific to this population.
And they're trying to change that with the organization's recently announced study called Voices of Black Women.
We're aiming to really better understand why Black women are diagnosed with more aggressive types of cancer and why upon diagnosis they have poorer outcomes than really any other racial or ethnic group.
Doctors Lauren McCullough and Alpa Patel are co-leads on this massive effort that aims to enroll 100,000 Black women across the 20 states seen here in red, along with Washington, D.C. Those locations chosen because ACS says they're home to more than 90% of Black women in the U.S. Participants must also be between the ages of 25 and 55 and have no history of cancer. Plus, it's a long-term commitment, agreeing to answer behavioral, environmental, and lived experience type questions over the next 30 years.
You'll complete surveys every 6 months, so about an hour of your time each year. The important thing to understand about these types of long-term studies is that we don't have to wait 30 years for answers. We can start doing work once we have a critical mass of women enrolled in the studies.
But they acknowledge it won't be easy to reach that enrollment goal of 100,000 women, in part due to past inequities and even mistreatment of Black communities in medical research and care. The ACS has found about a third of African American women say they've experienced racial discrimination at a health provider visit.
How do you work to overcome that and any distrust that might cause?
And I think the first thing is really understanding the perspectives and the experiences of women, ensuring that our study team was representative of the population, because it does matter. The second thing is really building trust with these communities.
And to do that,
who can join, why would you join, and what's involved?
They've enlisted the help of women like Madeline Long, one of hundreds of volunteers now serving as trusted community ambassadors for the Voices study.
We must take back our health. If we don't, then what? The statistics will only get worse.
And as an ambassador for the Voices study specifically, what will that entail for you?
Getting the word out. Go to where the folks are. And then when we get to those places, let's have the conversation.
Madeline is also a cancer survivor.
So when my mom, my aunt, and myself were all diagnosed in 2011, I went all in.
And among the women she's encouraged to sign up for this study is her own daughter, Chanel Wade, who's now 32 years old, still cancer-free, but worried.
She brought it to me in a, have you heard of this? It didn't take much to bring me on board. I have a 2-year-old and a 6-year-old. I would love for this not to be a concern of theirs.
She said, I want to be a part of how do we change the trajectory in our community for Black women. So I'm very proud of her.
Back at the radio station,
Hey family, you know what it is. 5 minutes now past the top of the hour.
Asia Chandler says she too decided to take part.
It's near and dear to my heart. We can help just save one person. I feel like I've done my part.
And as a public figure, she plans to keep talking about it, both on the air and off.
So yeah, I encourage people all the time to sign up.
Even the name of this study, For Asia,
21212.
hits home.
Because we need to use our Black voices. We need to be heard, and we'll do it together.
We also spoke to a nonprofit called Black Women for Wellness that's really laser focused on health equity. Leaders there say it's significant that the head researchers on the American Cancer Society study and their entire scientific advisory board are women of color.
That comforts me to know that Black women, because we all understand and collectively know what we need and what we want and understand our history. And the second thing is to make sure that they provide with a timeline. You know, there may be some people who aren't around in 30 years, but will provide this data to your family or to whom you designate.
As for why that transparency and communication are so important, advocates point to the story of Henrietta Lacks as just one example of a Black woman who was exploited for medical research. In 1951, doctors took a sample of Lacks' cancer cells without her permission. They were the first human cells found to continuously grow and divide in the lab, and have since been used in countless medical breakthroughs, including the development of the polio and COVID-19 vaccines. Lacks' family recently settled a lawsuit with a biotech company they accused of making billions of dollars off her cells, again without her knowledge or her consent.
American Cancer Society researchers stress no medication or clinical test are part of this VOICES study, but they estimate it could take about 3 years to sign up 100,000 Black women. You can learn more about the VOICES study by going to investigatetv.com and typing Voices of Black Women in the search bar.